Meeting of the Apache Junction Health and Services Commission is now called to order. Shall we rise and say the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And we will call for the approval of the agenda for tonight. Oh, roll call first.
Chairperson Erickson,
Here.
Vice Chair Daniels,
She's on mute.
Vice Chair Daniels,
Here.
Commissioner Bory,
Here.
Commissioner Gerstner.
Here.
Everyone's here, you have a quorum.
Very good, thank you. Now we'll look at approving the agenda for this evening. I think it's on.
Just sounded quiet.
Okay. May we have the approval of the agenda? Everyone has it. Is there any additions?
I move that the Health and Human Services Commission accept the agenda as presented.
And I'll second that.
Would you like a roll call?
Roll call?
Okay. Chairperson Daniels,
Here.
Commissioner Bory,
Yes.
Commissioner Gerstner,
Aye.
and Chairperson Erickson.
Yes.
So move, Madam Chair.
Okay, thank you. And next, we have approval of the minutes from the February meeting. And I think we had a couple of changes.
Yes, and I believe that Barb provided the minutes to you and the motion to make those corrections.
Mhm. Okay, and should I state which corrections, or you've already got them?
No, it's in the motion, so
Okay.
if the motion,
I'm sorry, Madam Chair, you do need to state the corrections that need to be made, and then the motion will accept those changes.
sorry.
Okay, yes. Okay, and on page 3, paragraph 3 of 20082, it should be Vice Chair, rather than Erickson, it would be Daniels, okay. And the next paragraph down should be Vice Chair Daniels. And at the end of that sentence, it should be Chair Erickson. Okay, so we would need a motion to approve the minutes as corrected.
I move that the Health and Human Services Commission approve the regular meeting minutes of February 24th, 2020 with the corrections notated by Commissioner Erickson.
Okay, thank you,
And I'll second that.
thank you. Shall we vote?
Vice Chairperson Daniels,
Yes.
Commissioner Gerstner,
Aye.
Commissioner Bory,
Yes.
Chairperson Erickson.
Yes.
So move, Madam Chair.
Okay, thank you, thank you. And we have public hearings this evening for the funding.
Not public hearings, just business.
Oh.
Yeah.
Visit, well, actually, yes. You call them interviews. or
Presentations.
Okay.
Presentations, yes.
Okay, so we have 7 agencies that have applied for funding. for the 2021 funding that is available. And they are not able to be here tonight due to our coronavirus. However, we have all of the agencies on the phone and will be presenting each of their projects that they wish to have funding for. The first one is a presentation, HHS presentation. Do I need the number?
Just the agency.
Okay. By Empowerment Systems, with the representatives from Empowerment Systems providing information about their program that they wish to have funding for. Deep
Yes.
Beverage, Braden Biggs, would you like to speak about your program?
Certainly. Thank you, Madam Chair. This is Braden Biggs, Director of Communications and Program Development with Empowerment Systems. Do you all have the presentation in front of you?
Yes, we do.
Okay, wonderful. So if you can go ahead and move to slide 2, I believe, the proposal along with the cost. So Empowerment Systems is proposing in part of our entire proposal, 2 different parts of our proposal. So one of those is the outreach and enrollment for the total amount of $12,480. And that part of the proposal will cover work that occurs both at our office at Empowerment Systems within our resource center, or it's more commonly known as our CORC Center, which stands for the Community Outreach Resource Connection Center. And the Genesis Project as well, because we do cover both of those locations and provide services to members of the community in both of those locations. And of course, then the Genesis Project also includes the Apache Junction Community Resource Center as well. So as a part of the Resource Connection Center, the CORC Center within Empowerment Systems, that covers our staff to be able to go out into the community and do community outreach. So this will help to really just provide a central community-wide resource and a member of our staff to be more that community liaison, who would then be tasked with working directly with the Health and Human Services Commission, Heather's office, the city offices in general, as well as the Apache Junction Homeless Coalition, and the various other resource agencies. This would then just really help to establish a one-person point of contact who can connect clients to services, connecting clients to other agencies, or connecting agencies to one another in regards to facilitating services and helping to assist the client. So this is kind of considered a case management role, except we're not actually going to be case managing the clients. We are just going to be helping them facilitate the process through whatever resource or service that they do need. So this also then just helps us to ensure greater community presence and ensuring our clients and agencies' needs are met while we're all collaborating to provide access to the services. So a key example right now is obviously, amongst the COVID-19 and coronavirus, there's a lot of resources and agencies working together and trying to serve the community as best as possible. So this person would then help to serve as kind of a collaborating liaison for all of those and help to just steer the mission forward for all of us together. And then we are also proposing a laundry program, which I'm happy to say we actually were able to launch that today. So we will be moving forward with that. But that piece of the of our proposal is for $3,520, which will provide us for a 1-year pilot program for this and help us launch this. So our total yearly cost to actually be able to run this program is $4,800. However, at this point in time, $1,280, or the difference between the 3,520 and the 4,800 is being subsidized either by empowerment systems, its partnerships, businesses, and community donations. Our goal with that is to be able to provide 50 vouchers per month or 25 per event. So this event will be happening every 2 weeks. Like I said, it started today over at Superstition Express Laundry. So this allows us to provide at least 50 clients every month minimum. We may be able to do more if we have additional community funding, with access to clean clothes, and which of course helps on a health and human services perspective to drive down diseases and spreads and things like that. So that laundry program is going to be specifically for the homeless or at-risk community, and that is going to be spread out between Apache Junction Unified School District for the McKinney-Vento children, my office at Empowerment Systems, and then the AJ Resource Center to be able to sign clients up and get them access to that. So moving from there, you can move to the third slide. And this slide is all kind of talking about what's included in outreach and enrollment. So that includes our ID cards, which are roughly $12 to $16 a piece, and helping get our homeless clients and people in need, or new residents to Apache Junction who might not have the funding, access to a driver's license, social security card, other vital records, birth certificates, as well as state-issued ID cards for identification purposes, which can also then help to get jobs and things like that. And then we also provide access and application assistance for SNAP, TANF, the Marketplace, Kids Care, Arizona at Work, CARA, unemployment, as well as partnership collaboration for the homeless coalitions from Apache Junction, Casa Grande, and Pinal County. And we work with all agencies to ensure no duplication of services and no siloing is happening. We also help to coordinate the AJ Project Connect and the point-in-time count volunteers, and the coordination of the Heat Relief Network. So that's a pretty broad spectrum range of what's going to be in the outreach and enrollment. Moving on to slide 4 on how we'll measure the impact. Empowerment
Braden?
Systems currently, yes.
You need to speed up. I think each agency is limited to 5 minutes. Is that correct?
Okay, no worries. Yep. So just measuring the impact, you can see, I do believe if it's attached, the Cork report, which is our center report, is attached there. So you guys have that and how we kind of measure our impact. We are working on developing those measuring tools for the laundry program. And we're really not just worried about the impact, but the outcome as well. So our goal is to be able to be really able to report that back, not just on numbers served, but the outcome. So did that person who got that ID, did that help them get employment, et cetera? As far as duplication of services, I kind of addressed that already. So clients at the Genesis Project or the Community Resource Center may also visit any of the other agencies in the community, my office included. However, we don't believe that there is any duplication of services, but as all of our agencies work really hard to kind of ensure that. But we do help one another out, and we do see a lot of the same clients to provide wraparound services, as we all do a little bit of different things. So, and then overall, just kind of our fundraising ask, while we certainly understand that funding is limited, we are hopeful that the Commission would be able to fully fund us as an agency. And if not, then we would be looking for that outreach and enrollment piece, so that $12,480. So that pretty much wraps it up.
Okay. Do any of the commissioners have questions?
How do you determine, this is Judy Bory, how do you determine AJ residents versus other outside residents?
That's always kind of been a major challenge when it comes to the homeless population. We base that off of where they geographically live. So, in particular for a homeless client, if they tell us that they live, on Broadway and Ironwood, I mean, that's a good indication there that they are, here in Apache Junction. That's also a part of why we have that identification card system is the hopeful goal is to find a way to get them to have some form of ID. We also are looking into options as far as if voter registration works. That's been a frequent conversation between my office and the city clerk's office. And we believe that a voter registration, if that person is registered, would classify them as a resident of Apache Junction.
Are they able to use P.O. boxes, box numbers?
The P.O. box in Apache Junction would classify them, it is my understanding, as a resident of Apache Junction. Heather might have more information on that, but that would be my understanding that they could potentially do that.
Any other questions? Okay. And it looks like you are collaborating with a number of agencies and, looking at the ID cards and other types of identification. What other agencies, I think you may have already mentioned this, but what other agencies are also providing funding so that the individuals can get that?
Currently, we do not have any funding for the identification purpose. We have been seeking donations and community donations for the laundry program, but anything under the outreach and enrollment at this point in time, I'm not aware of any agencies. Yeah, there are no agencies that help fund the ID cards or the access to the application assistance through like SNAP or Kids Care or anything along that line. And then all of the agencies that participate in the homeless coalitions help to commingle that, so that provides access for the Heat Relief Network and Project Connect and the Point in Time Count. We all work together there. But for the laundry program, it's community donations. The Friends of Apache Junction recently made a donation. A few of our local businesses have also made donations, and community members as well.
Okay, thank you. Next, we have a presentation and discussion for Health and Human Service Commission funding from Horizon Health and Wellness, Representative Sherry Debris. Is Sherry available?
Okay, there's my signal. Can you hear me okay?
Yes, thank you.
Okay. Yeah, thanks for the opportunity to present tonight. I'm just going to start with a little bit of mental health information just to kind of lay the groundwork for why we feel that mental health first aid and the youth version would be really good to bring into the residents and staff members that work with youth in the AJ, in the city of AJ. So mental disorders are common. Now they've got them just as common as heart disease and cancer combined. So about 1 in 5 Americans experience a mental illness in any given year. Of those, unfortunately, about 43% of adults and 51% of youth end up actually seeking and being in treatment. And so those numbers are quite low. We feel like bringing mental health first aid training to AJ will address 2 of the 3 priority areas that were identified in the Pinal County Community Health Needs Assessment, which included substance use, abuse, and mental health in general. So with 2 of the top 3 urgent areas of need falling into the behavioral health category, we feel like preventative education and awareness and ongoing supports in Pinal County, and especially in the city of AJ, would be helpful. Mostly because of the fact that there is a high occurrence of mental health just in general, 1 out of 5, but also seeing that there's been a steady increase in suicides in the United States, and Pinal County in general mirrors that increase. So there's been about a 31% increase in rates of suicide since 2001. Suicide is now the 10th leading cause of death overall in the United States, and in as many as 4 out of the 5 cases, when they looked at them, of completed suicides, there were clear warning signals that those folks had been giving off prior to their death. And so with training, especially and specifically mental health first aid, people can be or would be more able to see those warning signs clearer and quick and a little bit quicker and intervene earlier for those folks. And now I am sorry, I'm not telling you what slide I'm on, but I'm already on slide number 3 here. While many Americans know how to administer first aid and seek medical help, should they come across somebody that's having a medical issue, few are trained or mostly don't feel comfortable providing similar help to someone experiencing a mental health crisis. So mental health first aid helps people know the mental illnesses are real, they're common, they're treatable, and it's okay to help someone, to reach out to someone, and to talk about it. So mental health first aid does a really good job in reducing stigma, removing fears, and instructs people on how to administer help until they can bridge this person over to some professional care. So when people are more equipped with tools and they're more comfortable with the dialogue and actually asking and noting concerns and starting conversations with folks that they see are in mental health crisis, the quicker that we can get those folks some needed help. And so that's all about mental health first aid and kind of the need for that. I wanted to talk a little bit, because I know you all had questions about our grant proposal that we wrote last year. So although Horizon hasn't been able to spend down that grant, in fact, we haven't turned in any bills as of yet for that grant money, COVID-19 willing, we're fully anticipating spending down that grant money by the end of the grant cycle. And so we actually had 2 trainings scheduled. One of them was for Safe Talk Train the Trainer, where we would have turned out 10 Safe Talk trainers, and they were scattered throughout the city of AJ. We had school employees, we had folks from the different social organizations that work with youth. We had folks within Horizon, but we had 10 folks that were slated to become trainers, which originally their proposal was just for 2 trainers of Safe Talk to be going out into the community. So exponentially, it's going to increase the amount of impact we can have on the community once we get those trainers trained. And so we're hoping that in June, before this grant cycle is done, we'll have those trainings done. And then we also had an assist training that was also scheduled in April that we've also had to cancel for now. And again, we're hoping to have that May or June, again, if this COVID-19 epidemic kind of gets past us. So with those 10 trainers, again, back to Safe Talk, the assist was just a community training, but the 10 trainers that we are going to have for Safe Talk, those trainers can train beyond the grant cycle. They'll continue to train into the future, and so it will help get that information out there in a great way. In our new proposal, to switch over to that, Horizon is asking for a total of $25,000, which allows us not only to train 2 Horizon staff to deliver both mental health first aid, which is an adult version, but also the youth version of mental health first aid. So we are also not only doing 2 Horizon staff, but 2 staff from the Apache Junction School District that have been longstanding employees there. So this would allow us, again, to multiply the effects of the funding by having 4 trainers out in the city of Apache Junction doing these trainings. Typically, you'll have 30 attendees in a class. We're planning at Horizon alone 10 to 12 of those classes over the year this grant would cover, and then whatever else the school employees can do, that would just be bonus on top.
Sherry,
again,
your 5 minutes is nearly up.
Okay, I'm wrapping up.
wrap it.
Okay, so our plan is to do all of those trainings and then to have 2 others out there training as well. We are hoping to reach Apache Junction School District staff and students, charter schools, Boys and Girls Club staff, first responders, city officials, multi-gen center staff and members, RV park residents, because they also have a very high rate of suicide and mental illness, and then community trainings as needed. So by granting us this funding, we'll be able to bring all 3 trainings. We'll continue to do the Safe Talk training beyond this grant cycle here, and then mental health first aid and mental health aid youth. And so if the commission feels here's an option that maybe we need to concentrate on youth this year more so, or we need to concentrate on the adults in the city of AJ, then the proposal is broken down in a way that you could say, hey, we want to fund the youth side or the adult side and have you just take that and go. So if it came down to the fact that $25,000 is a little much for everybody else's ask, then you could choose one route or the other.
Okay, thank you very much.
You're welcome.
Commissioners, do you have questions?
This is Judy. Grief counseling, is that going to be part of this first aid training also? Like to
Well,
some
the
of the
wonderful-
some of the churches that have grief counseling?
Sure. The wonderful thing with this that can be written in at any point in time, if you wanted it to be, more of something that's actually written into the contract or the grant proposal, is with Horizon Health and Wellness being right here in AJ and having, licensed clinicians and licensed peer staff. Peers are folks that have gone through mental illness or they've had folks in their family with mental illness. Grief and trauma is something that we specialize in, and so something that we can do with this is once this mental health first aid gets out there, and again, church members, church staff interact with adults, they interact with youth, so they would definitely be an audience that we could do these trainings with, and then afterwards, those services could be offered because we already offer those at Horizon, and so that could be an after fact, something that just kind of comes up as a need. We would be able to handle that.
Okay, thank you. One other question, how many current staff are trained? Do you have current staff trained with Safe Talk and Assist or with mental health first aid for adults or for children?
No. So what happened with the grant last year, that was the entire purpose of the grant before I came on. So I came on in October, and then because the two people that were trained in Assist, they left the agency, unfortunately. When I came in October, I then quickly tried to get into these trainings, and the trainings are very rare. They fill up super fast. You have to, travel all over the country to get into these trainings. They're not as easily available as mental health first aid, and mental health first aid train the trainers, and so we didn't get into those. We tried.
Mm-hmm.
And then with Safe Talk, we actually identified a local in-state master trainer, and that's why we're going to have that master trainer come in, and she can train. Actually, we have 11. We had 10, but she allowed us to add one more because AJ School District wanted to add an 11th person in for Safe Talk. So we'll end up, with 11 trainers through the grant funding that's already been given, to us from last year. For mental health first aid and mental health first aid youth, I was a trainer for both of those curricula before, so I only have to go through a simplified version of that training, and then we would have a second person at Horizon that we've already identified that's been with the agency for a long time. So the hope is that, we don't lose these folks. I'm hoping to stay, so I'm one of them, but the other person, has longevity, and so the hope would be that, again, that we would train this person and they would be here for the year-long cycle of the grant. And then in the AJ School District, same thing. They have a kind of like an application, a screening application you can do with your potential mental health first aid trainers. And you can do that, and it just kind of says, like how long have they been with the agency. So it's long-term standing school employees that would be the other two trainers for those two programs.
Okay, thank you very much.
Mm-hmm. And those trainings are rapid. They're easily attended. They have local ones all the time, but they also have many, many more. Assist trainings are just very, very rare, and Safe Talk as well. But we just got lucky with Safe Talk, and with mental health first aid youth, it'll be easier to get into those trainings quickly and get those done and get boots on the ground.
Okay, thank you. Thank you.
You're welcome.
Our next presentation is from the Community Alliance Against Family Abuse. The representative speaking will be Ray Villa.
Good evening. Thank you. This is Ray Villa. I'm the Executive Director with the Community Alliance Against Family Abuse, and with me on the line is Mara White, who's our Director of Programming, and Danielle Webster, who is our grants manager. Commissioners, thank you for allowing us to apply for the City of Apache Junction's Health and Human Services funding and inviting us to present our proposal today. I'm going to start out with slide number 2. For fiscal 2021, we have requested $18,000 to provide services to our domestic and sexual violence survivors who are residents of Apache Junction. Just to kind of give you a little rundown about CAFA, our service territory covers all of Pinell County and eastern Maricopa County. And this past fiscal year, we served 449 participants across all our programming. This includes 28 residents of AJ who were able to provide proof of residency and an additional 51 AJ residents that were unable to provide proof of residency. This is common in domestic violence situations because people often flee without grabbing any documentation, or their abusers may not have them allow them to have any utilities or bills listed in their own name. This last fiscal year, we were reimbursed for 369 hours of services to verified AJ residents and provided an additional 1,963 hours of services to AJ residents who could not provide proof of residency. Based on these numbers, our fiscal year 2021 request for support from the City of Apache Junction represents about 16% of the actual services CAFA expects to deliver to people that self-identify as AJ residents in this next fiscal year. One of the other things that we're doing is we would like to continue to explore options with the city for ways that AJ residents can verify that they live here. We're hoping to maybe move forward with that. Additionally, I wanted to let you know that CAFA's domestic and sexual violence services are low barrier, personalized, and trauma informed. Services are delivered in the community or in our crisis shelter, which is located here in AJ, where we serve single adults, families, all genders for up to 120 days. And we also offer an off-site accommodation for their pets while they're in our shelter. And going on to slide 3, the requests will be used to reimburse for costs associated with delivering the following intervention services to verified AJ residents. First, domestic and sexual violence advocacy, including a variety of services, including case management, safety planning, supportive listening, advocating for victims within other agencies, information, and referrals. Lay legal advocacy for lay issues related to their victimization, empowerment counsel support, who leads support groups and facilitates one-on-one sessions with our survivors. Thrive, which is a transition-in-place program similar to rapid rehousing, and City of AJ funding would not be used for direct financial assistance, only to support advocacy in intensive case management with these individuals, and also to support a 24-hour crisis line. On the next slide, slide 4, we provide anonymous surveys to our participants to see how well we're doing. And this last year, we received back our surveys with the following results. 95% reported now knowing how to assess and plan for their continued safety. 94% reported that CAFA services assisted with their emotional healing, and 94% reported satisfaction with the services we provided. And going on to the next slide, we also provided some additional information. We submitted 2 documents to our application package that listed other funding sources, both governmental and corporate and foundation. We have included them again today as handouts for questions posted during your commission's meeting last meeting that you had. We do not anticipate substantial funding between now and July, as our major funders operate on a fiscal year or federal fiscal year. We will likely receive a couple of smaller grants, less than $5,000, and individual or grant donations before July. We do not anticipate ending the fiscal year with a budget surplus. Receipt of the funding at the level requested will help ensure that CAFA is able to maintain service levels for AJ residents in the next fiscal year. Lack of receipt of funding may mean that we need to reduce services, meaning that less survivors will be served. Again, that's our presentation. It's quick and short. Thank you for giving us the opportunity to do the presentation, and we're open to any questions that you may have.
Okay. Thank you very much. That was quite thorough. Commissioners, do you have questions?
No.
Oh, okay. You did a thorough job of it. Thank you.
Thank you very much for the opportunity.
Okay, our next presentation will be by the Boys and Girls Club of Metro Phoenix representatives Russell St. John and John Patrice Brown.
Hello. Thank you for giving us the opportunity to present. Unfortunately, John couldn't make the call tonight, so it'll just be me.
Okay.
And just to let everybody know, we did get our official new name. We now are Boys and Girls Club of the Valley. So that is our new name moving forward. So to start with slide 2, basically we wanted to just kind of go over some of the things that we do here. Our 5 key elements for positive youth development, we have those in every area that we do. The first one and utmost is safety, safety of the kids, both physical and emotional. We definitely want to make sure that the kids are physically safe here from bullying, things like that, and then emotional safety as well to make sure that everybody feels safe and happy and want to be here. The second one is fun. Of course, we want all the kids to have fun no matter what we're doing. Even with homework help and things like that, we try and do different stuff. We would give all the kids opportunities and expectations, some opportunities that they wouldn't normally get to do at home, and expectations as far as what we require of them and what they can expect from us. We have supportive adult relationships. The goal is to have every child to have one staff that they can go to if they're having a bad day. It doesn't have to be all the staff or a certain staff. It's just one of the staff, part-time, full-time, doesn't matter, that they can connect with and be able to talk about their day if they're having a bad day and things like that. And then, of course, recognition. We definitely want to recognize all the kids for what they do, whether it's playing a game or doing homework or, just having fun and recognizing them for that. Moving on to the third page, one of the priority outcomes that we were asking to support is our academic success program. We start by the young people who need us most, plus our outcome-driven club experience, which includes those 5 key elements for positive youth development. It also includes high-yield activities, which is having fun while learning something new. We have our targeted programs, which is our national programs, such as Smart Moves, which is helping kids make right choices. And our regular attendance, it's proven that they come at least once a week, 52 times a year, that their scores for education and everything else increase. And that equals our academic success, good character and citizenship, and healthy lifestyles. On the 4th slide, like I said, we're asking for support in our academic success program, which is our Power Hour, and that is basically our homework help time, and our Kids Lit reading program, which is basically reading them a story and having them comprehend it by asking questions and doing a project based on that story that they understand it. Just for the Superstition Mountain Branch from January 1st, 2019 through December 31st, 2019, there were 215 members that completed 8,417 hours of homework time. For the approximately about 100 of those were with City of AJ kids. And we verify those, and I also Google map every address that they have to make sure that they're within the city limits. So just kind of going off on that, a little bit about our homework help and things like that. The last slide is academic success. Other academic success programs that are facilitated at our club. We do run a program called Money Matters for the older kids, just basically how to, work with checking accounts, creating a budget, save and invest. We usually have partnerships with Wells Fargo and Bank of America, and they come in and help us out with that. Career Launch is basically prepares teams for the world of careers and work. We do different field trips to like EVIT and different universities and colleges, give them the experience of different things like that. And then Computer Science Pathway, we help the kids with coding, and we basically creative computing, doing different things online with that. And as far as that goes, as I don't know if most of you know or not, we are still open during this coronavirus. We're helping the frontline people so that they can get to work and have a place, safe place for their kids to go. So while they're here, they are able to access our online computers and get on and do their homework. So we have a time for them during the day where they can do their online work. And we are currently working with the Department of Education for the state of Arizona and creating this place, all our clubs, a place where the kids can go in their school district if they don't have internet, where they can go and complete their homework time. So some of the things coming up right now that we're working with as well. And that pretty much concludes the presentation I have.
Okay, thank you very much. Commissioners, do you have questions?
Roz, how many hours are you open?
Right now, we are open from 7 a.m. to 6 p.m. Monday through Friday. We have small groups. We are the only club open on this side of the valley. Our next clubs that are open are Chandler and Guadalupe. They've closed the Mesa Club, Stevenson Club, Queen Creek Club. So I have staffing from them, so we have an abundance of staff that keep the ratios really low, making sure, kids wash their hands all the time, and, of course, sanitizing and bleaching and making sure we're disinfecting everything.
Okay.
How will the merger with the Metro Phoenix Club impact your operations and your funding, or have you seen changes? I mean, how is that affecting it?
Not as of yet. We haven't seen any changes other than the fact that, of course, all our events are postponed. So our yesteryear event was canceled. It's rescheduled for October to help with our funding for that. So as far as that goes, that's pretty much for everybody in the Boys and Girls Club in the Valley. But as far as I've seen so far, there's been no impact on anything we're doing. We're still getting the regular funding that we normally get through the Boys and Girls Club.
So all your funding events then are canceled as of?
Yes, yeah, we canceled the yesteryear event, so that's going to be scheduled in October. I forget the day. I think it's 24th.
Okay. Thank you very much.
Mm-hmm.
Okay, our next presentation will be from the Apache Junction Community Development Corporation, and I believe we have Representatives Dave Waldron and Jim Duncan on the line.
Yes, thank you, Madam Chair. Can you hear me?
Yes, we can.
Great. Thank you again. I do have Dave Waldron on the line. My name is Jim Duncan. I am the Vice Chair, and Dave Waldron is the Chairman, and he is on the line as well to help answer questions. I'm going to go quickly. So, hi, Dave. So I'm going to go quickly, and we're on the number 2 slide, but I wanted to give a brief recap, real quick, 20-second, of the Apache Junction Community Development Corporation. These days, we don't like to say CDC too much at the end of Apache Junction because of what's going on in the world. So I'm going to try not to say CDC too often. So in 2002, the Apache Junction Community Development Corporation was created. In 2017, they decided that they wanted to reestablish their goals. And one of the main goals was to lessen the burdens of government through cooperation with and activities on behalf of local units of government. And in 2018, we revised our vision and mission statements, and those include the vision through community involvement, having a common and unified purpose to make a difference while providing conduits and assistance that enable a strong and sustainable community. Our mission is working together to maintain and create safe, affordable housing, support economic opportunities, instill a sense of community pride and commitment, and enhance the physical image of Apache Junction. Make a difference and volunteer. We're a 100% volunteer organization. We have no paid salaries on staff. So on this first slide, as you can see, our number 1 priority is administrative. It's the backbone and lifeline of the corporation. We just created a website which launched last August www.apachejunction.cdc.com, and in that website gives us the ability to streamline the projects and serve the needs of our community. Project requests, volunteer signups, donor payments, everything is being streamlined through this website. And you can see our expenses for the administrative. Corporations have to have insurance. We have this website, which is just beginning its early stages, postage, printing, etc. On the next slide, and again, at the top of that slide, and I'm not able to follow through with the presentation online. My feed is a little bit behind because of the extra use on the internet that's going on these days. But the starburst at the top of each slide actually shows you what that particular priority entails for the full year. So the priority number 2 for the Community Development Corporation is community revitalization projects, and that is a flyer to the far right that you see on the screen, which is fairly new as well, but it encompasses working for those people that need assistance in property cleanups, blighted property work, yard work, weeding, etc. And those are the people that aren't simply not able to do it themselves. Our third priority is household hazardous waste transport. Once again, something that our elderly and low-income folks aren't allowed to actually bring things to these 2 events that we have in the city each year. In fact, Chairman Waldron and myself visited the last one that was just held recently and spoke with the coordinator there and asked her, what do you do when people can't bring things to you? And she goes, that's a good question, because I have a lot of phone calls and I tell them, get a neighbor or somebody else. So it's just part of a process that we feel to have household hazardous waste around somebody's property is an absolute danger. So on slide number 4, Make a Difference Day. Once again, last year was our first ever Make a Difference Day. And mark your calendars this year, everybody. Saturday, October 10th is our next Make a Difference Day, and I am so looking forward to it this year. We had a great turnout, many projects in one day. We had 24 sponsors, 130 plus volunteers that included 7 different groups, communities of groups that came out and supported our community. We had 5 businesses that put groups together and supported this Make a Difference Day, and it was a huge success, and I know some of you have seen it on the news and some of you have seen the recaps on the paper. This year's event is October 10th. Again, multiple projects, and we're in the planning stages now, but to continue some of the projects that we've had from years past. On the the 5th slide, I added 3 priorities in the interest of time to make them go quicker in the presentation. But one of the most important one is priority number 5, which is the playground revitalization project. Right now, the Boys and Girls Club is not able to use their Field of Dreams that you see on the right-hand side there in those 2 pictures. And it's just, it's something that we would like to get involved, help them to get that usable, and not only that, but get a sustainability for themselves. We've had a couple of conversations with them on site where they could have some youth programs. So if we can get 3 or 4 lawnmowers donated from some of our local businesses or even some national businesses, that we could actually give them the tools to maintain it moving forward, or we can come through and help maintain it as well. But the idea is to get that field usable. It's not being used. Priority number 6, and on the second part of that is the Apache Junction High School track replacement, which is a phenomenal event in itself, and it's not something that the Apache Junction Community Development Corporation can do on its own, nor would we even be close to being able to replace that $1 million project that they have to do it. But maybe we can be a part of that or get it so that it can be at least used, which is a phenomenal feat. Priority number 6, our Focal Point Brick Memorial. In the center of our city, where we all met on Make a Difference Day last year, we have a Focal Point Brick Memorial, which a lot of people don't realize it's there. It's a program that is just awesome in respect to our loved ones. There are sections in the memorial where a brick is placed in the ground as a memorial. And what happens is they have sections all over the focal point so that you can walk around and see the names and the people. There's a pet paws and claws.
Can you wrap it up, please? Sorry to
Getting
interrupt.
very close. And then the last priority, number 7, is illegal right-of-way road sign removal, which kind of is self-explanatory. Our city has a lot of those. So let's go to the slide number 6, which is, it's the wrap-up. So in regards to the Community Development Corporation, we have projects for quarters, and none of the projects are the same. We're always doing something different, and they're based on the needs of the city and the community. And I know some of the questions you had for us is detailed breakdown of the priorities, which we've given you, the impact and results. Well, if we don't have the administrative expense, then the corporation doesn't exist. So I guess that's the top priority, and that's why we listed it as number 1. So I'll kind of leave it at there in the interest of time and ask if there's any questions.
Commissioners, do you have questions? Okay.
I know I went fast, and I'm really sorry.
Madam Chair, this is Dave Waldron. Can I make one little point?
Yes, please.
So there's clarification. The Boys and Girls Club are not provided any funding for facilities maintenance. So they don't have the ability through their funding cycle to put any dollars towards the Field of Dream and trying to keep it in shape and keep it up to where the kids can actually use it. That's why we have it listed for us.
Okay. And it sounds like you have some wonderful community collaboration with the many people you're able to mobilize. So kudos.
Oh, it's awesome. Arizona Sustainability Alliance, Central Arizona College, many of the churches, all the volunteers that come out. We are a volunteer-based charitable organization.
Well, thank you. Thank you for applying this year.
Thank you for allowing us.
Thank you.
Okay, the next one that we will hear from is the Superstition Food Bank, and Myra Garcia and someone else is presenting.
Hi, this is Phil Tremonti. Can you hear me?
Yes, we can.
Okay. I am the treasurer of the food bank, and along with me listening in is Bob Moe, who is our president of the food bank, as well as Myra Garcia, who is the one that makes everything happen. She's our executive director. The food bank started in Apache Junction here in 1983, and the real corporate name is Apache Junction Reach Out, Inc. We are the largest emergency food bank in the East Valley, and we send out more than 1.5 million pounds of food each year through our warehouse to almost 40,000 people a year. Our mission, as I put it there in the outline, is together with our volunteers and partners, the food bank provides emergency food to qualified individuals and families in the East Valley communities with kindness, respect, and dignity, which is really a big, important thing for us to consider. Our service area is approximately 100 square miles. And accordingly, we go beyond just the boundaries of Apache Junction. Although the majority of our people that we serve are from Apache Junction. But we have just recently changed our DBA to the Superstition Community Food Bank to better represent the geography that we serve overall. But in addition to giving food to people as is needed, we also help them try to learn how to fish as well as giving them fish. By networking them to other agencies as we find out through surveys and others what their needs are and what their problems are, we are networking them to other agencies in the community that can help them. And we're also purchasing and providing them with food and recipes that will allow them to focus on healthy eating overall. The success of our mission is contingent on achieving 3 objectives. First one is getting enough food to service all those in need. The second one is getting enough volunteers to make sure we can sort and pass out the food. And the third is, can we raise enough money to cover our costs? We, in 2019, it's on your second slide, I believe it is, under yesterday, we distributed 1.6 million pounds of food to almost 37,000 people. And that's about 43 pounds per person. Now recognize we can only give out food to people once a month under the emergency basis. 60% of those people were residents of the Apache Junction area. Of the amount of food that we passed out, 50% of the food comes from the 18 grocery stores that we collect from daily. That's where our food came from. In addition, we had an average of 125 volunteers each month, and they're mostly from Apache Junction and Gold Canyon, and they provided 18,000 hours of volunteer hours, and we did this with 4.5 full-time equivalent employees. So we only had 5 people working and about 125 volunteers each month. In 2019, we spent $309,000, or about $8.44 per person, on distributing the food. And that included about $10,000 of food that we had to purchase ourselves. In addition, we distributed $74 of food per person as they came in. That's the 43 pounds. The city of Apache Junction graciously granted us $24,500 for this current fiscal year, or basically $1.09 per person from Apache Junction. Today, we expected an increase when we did our budget of about 10% in the number of people from Apache Junction that we would service. And we did that increase because we were expecting some kind of an economic downturn, and there's some negative repercussions that I can discuss if you want to know of increases in the minimum wage. Our budget for the year was $359,000, or roughly $8.99 per person, which is about a 6% increase from the prior year. That included about $15,000 for food. Then comes along this thing called the coronavirus. January and February months were normal as we had planned and budgeted. We normally distribute 28 to 30,000 pounds of food per week and receive 14 to 15,000 pounds from our grocery outlets. This week we got 8,000 pounds in total. So this week we just went out and just purchased $20,000 worth of food, even though we had a $15,000 budget, to basically replenish our needs. In addition, we had to cut our distributions from 43 pounds to 23 pounds in order to make so that everybody got something here. Our volunteers are down about 25%, and that's primarily because of people adhering to the social distancing rules that are put out, because the Canadians have gone home. They were forced to go home. And last but not least, if this continues, we'll probably have to call, like St. Mary's, bring the National Guard in to help us to sort and spread things out. In addition to that, the stock market crash has eaten up 25% of our cash reserves. So I don't know how much longer we can give $20,000 in purchases every month at this point in time. Overall, we are asking for $27,500 from your committee, or roughly $1.13 for the number of Apache Junction residents we expect to serve. As we go into the future, as we get, hopefully we have a future, just so that you know where we're headed, we are basically ready at this point in time. We've got the efficiencies in place that we know we're going to be able to service the extra 6,600 acres that Apache Junction is now annexing. We will be able to service that area. We have enough capacity to do that. We are going to be going through some capital drives, but for us to raise money for capital needs is relatively simple. Our real problem is raising money for purposes of ongoing operations. That's our whole picture. Is there any questions I can answer?
Okay, thank you very much. Commissioners, do you have questions?
With people going back earlier, is there a drop in the numbers that you're serving?
When you say people, you mean you talking about the Canadians?
No, not just the Canadians, all our winter visitors that go back home.
You know, as a general rule, the people that we serve are residents in these communities. So they're not going back. They're not the snowbirds that come in. And in fact, those snowbirds are the ones that come in and act as volunteers for us. But no, we don't have a problem with the drop-off. In fact, there's an increase now because of what's going on. And I mentioned the minimum wage a minute ago. One of the problems with the minimum wage is the fact that the state has increased it to $12 per hour. So a person working full-time is now making $24,000 to $25,000 a year. That means that they're making too much money to have to get into Access or Medicaid, and they're making too much money to get food stamps, which in turn means they got to come to us for some food subsidies as well. That's the problem we're facing with that.
Okay.
Okay, thank you very much. Our next presentation, and this is our last, thank you everyone for hanging in there. We have 7 amazing organizations presenting this evening, and we are with the final presentation at this point, and we will be hearing from the Genesis Project and the representative Trinity Cole.
Hi, thank you so much. This is Trinity Cole. I am president of Genesis Project. I will begin with slide number 2. Who is Genesis Project? Genesis Project began in 2006 with a mission to feed, clothe, and hydrate the needy and homeless in Apache Junction. We offer the basic human needs of meals, clothing, and water. So we do hot meals, to-go sack lunches, clothing, socks, shoes, hygiene items, hydration by way of bottled water. We also provide nursing triage on Mondays and shower vouchers as well to give those who do not have access to hot water or shower facilities the opportunity to shower. We serve anyone who is hungry, and we see elderly, families, youth, those without housing, those who do have housing but are unable to provide themselves maybe with medication and food. So we, on average, see 148 people per day, 7,224 meals average served per month in 2020 so far. And in 2019, we served 86,912 meals, which was a 17% increase over 2018. For our clothing and hygiene, we see about 38 people per day. We do this through private donations from individuals, local churches, and clubs in the area. We also have a partnership with the United Food Bank that provides us some of the food we collect, and we do have local grocery store pickups with a few of the local stores. The community needs we meet were identified in the Apache Junction Strategic Plan on Homelessness. And we are increasing the number of people we are feeding. We provide access to free clothing and hygiene items. We are part of the Heat Relief Network and offer that space for extreme heat days. And we also just provide a safe space where people are able to come and hang out in our lounge in Unit 11. We have increased our water storage and distribution, and we have a community partnership with the AJ Community Homeless Coalition. Moving on to slide 3. Sorry, I'm going kind of quick to be mindful of time. We have asked for $12,000 for this fiscal year, and that will provide access to essential services for a minimum of 10 hours a week, that being the hot meals. The heat relief space will be available 20 hours per week. The community space also 20 hours per week. And then that expanded water storage and distribution will provide access for a minimum of 20 hours per week as well. We also have space for agencies to provide outreach services through the Apache Junction Community Resource Center for a minimum of 20 hours a week. We see this model of having the resource center open where the agencies are able to come and meet the people where they are, as opposed to having the people come to the agencies. It provides a one-stop shop kind of environment to access many agencies at one time when there's several needs that need to be met. Why Genesis? We have proven our success since 2006. We are the only agency that provides hot meals and essential services in one convenient location. So guests are able to come on site and access a hot meal. They're able to get a shower voucher. They are able to see Nurse Judy for a triage visit, and then they can get their hygiene essentials such as soap, deodorant, toilet paper, those kind of things that they're going to need. We are also the only agency who offers space for the Apache Junction Community Resource Center, which is, again, that collaboration with the Apache Junction Homeless Coalition. And we are a proven community partner in Apache Junction. How will it hurt if we are not given this $12,000? If we don't receive it, the services in our expansion could cease to exist. Genesis relies on donations for our operations budget. That is the conclusion. If anyone has questions.
Okay, thank you very much.
Thank you.
Commissioners?
No.
How do you track the number of people that come through? How do you keep track of them? Is it on paper, on a computer program, or?
Yes, everything is tracked on paper. Our guests enter through our front doors and then they sign in to receive their meal. Everything is tracked there on paper with those sign-ins. At Unit 11, they also come in and they take a number, and those number counts are recorded each day.
Okay.
How are you currently meeting the needs of the people that you normally serve?
I'm sorry, could you repeat that?
How are you currently with what's going on right now with the COVID-19? What measures are you taking?
We have completely changed our operations to be a to-go model. So instead of having our dining room open at this time, we have converted our storage room to a drive-through window, and they have gone from coming up to the door to get their meal to going to that window and getting it there. They then proceed through the line and get their to-go lunch bags and that. So there is a no-touch method that's being modeled at this time. We also just put a hand washing sink out in front of the building so they're able to wash their hands outside without entering the building.
Thank you very much. And I'd just like to take a moment to, say that we've heard from 7 amazing nonprofit agencies in the city of Apache Junction. And you use creative ways of meeting the needs of those that are the neediest within our community. And, especially now, I have heard stories of how these nonprofits are coming together, are working hand in hand to really meet the needs that are presenting now and will present as a result of what we're currently going through as a community and as a nation. So I would like to take this opportunity to thank each and every one of you, as well as the other agencies and individuals, volunteers, that have stepped up to help. So we will be meeting again, well, I don't know when, but it may be virtual. So, and one of the challenges that the Health and Human Service Commission, and I also have to mention that Apache Junction is one of few communities that has a Health and Human Services Commission that really reaches out and works with nonprofits. And I have to thank the city of Apache Junction for making it possible for our nonprofits within our city to come let your needs be known and to reach out for funding. And what we have as a challenge now is to determine how to allocate the funds. And unfortunately, we have about twice the number of requests of funds, the amount of funds as we have available to provide. So we will do our best to be equitable and to be able to make wise decisions. So thank you all for your time this evening and for presenting the projects, the programs that you are seeking funding for. So we have the next item on our agenda is under new business, and we have one of the members of the commission that needed to resign, and I would like to acknowledge Jennifer Miernicki's service to the commission and thank her. But we do need to go through a formal process, I believe, for accepting the resignation. Is that correct?
Thank you, Chairperson Erickson. We don't need to officially accept. We're just acknowledging that she resigned and thank her for her service is all.
Okay, thank you. Again, thank you very much. And, we thank Jennifer. The next item is a presentation and discussion on hosting a panel discussion on health in Apache Junction, specifically for those experiencing homelessness, those who are very low income, those with mental health and addiction issues, and creating a list of questions to ask the panel during the May 13th Mayor's Breakfast.
Thank you, Chairperson Erickson. At this point, whether the mayor's breakfast is held on May 13th or not, or pushed out, and we certainly intend to have that. And we do that every 6 months. And so the idea here is to bring together different viewpoints, different organizations that provide health-related services in our community, and do a panel and just ask them some questions. So we do have agencies, that mental health agency, we have our Horizon, which is our federally qualified health center. We have other providers from varying arenas. And so the thought this evening is to just throw out some ideas of questions that we could ask them, just to get a handle on. The commission here has talked several times about what are the health needs in our community, so that you know what it is that you want to address, so that you know what our needs are. So this is an avenue for you to get that information. So I guess it's just throwing it out there. Any potential questions, I'll write them down and then share them with you at a future meeting or via email, and then those will be the questions that we can ask the panel when we do hold the mayor's breakfast, yet to be determined. And the thought too is that maybe these questions could be broad so that all of them could answer it, but enough that it will meet your needs to figure out where you guys want to focus the commission. And then, of course, this being sort of hosted by the commission, then we would like to ask Chairwoman Erickson to sort of be the moderator of that and ask those questions. And it's just, the mayor's breakfast has been an avenue for us just to share information and learn about different aspects in our community. So this is just something that I thought would be great for the commission to participate in.
Mm-hmm. Well, I have a whole list, but I want to hear what others have to say.
My question would be about housing.
Can you speak up, please, or speak into the microphone?
Sorry. My question would be about low-income housing and emergency shelters. Why don't we have any? And where can we get someone to start the initiative? Is there a law or something that we can't? I'd just like to have more information.
Okay, so that would actually be a great question for our healthcare providers, because some of them do get funding through Access and other areas to get people housed. So that is a great question to ask, absolutely.
Are there any empty buildings that could be converted to shelters in Apache Junction?
Definitely, that would be a discussion point, which would be a part of the same train of thought, probably, yes.
Yeah, so basically, the panel being healthcare providers, what are they doing to impact housing for their clients and for other people who are, whether it be a mental health issue or a substance abuse issue or whatever it is, their clients, how are they helping to get them housed?
Also, maybe something in the job venue or training for jobs, or are there anything, well, I know like Mark Center used to do different programs than we had at Mark Center, I thought, here in AJ, and I don't believe we have it anymore, do we?
Well, it's technically in the island, but it has an AJ address, but it's not in the city limits, but they are still there, yes.
Okay, I'm thinking of just in opening possibly, to get their opinion and what they see as Apache Junction's greatest strength and services, and what is their the largest gap that they see in Apache Junction. So, I think it would open it up to everybody to address from their perspective, be they mental health, physical health, looking at social services. Different eyes have different priorities, and so I think that would be something that could open up the conversation. Do we still have a commissioner on the line?
Yes, I'm still here.
We can hardly hear you.
Oh, okay. I haven't said much, but I had one of the same questions you already asked, so I'm good.
I still am not hearing her.
Madam Chair, I believe she said she's on the same page.
Okay.
Was that correct, Vice Chair Daniels?
Yes, that's correct.
Are there any other questions you can think of that you would like to see asked this panel?
No, I was in agreement with your statement on asking them where they see some needs that we're not meeting.
Mm-hmm.
And maybe ask how they reach those that don't have internet or don't have the money for newspapers, coupons, clippings, and those that live out on the mountain.
Mm-hmm. And if we're looking at homeless, the homeless population, there are different ways that you are addressing their needs. So what types of prevention services does Apache Junction provide for preventing people from becoming homeless? What's out there? What are the needs in preventing homelessness? And then you look at, is there any street outreach? And if so, who's doing it? How are they doing it? What types of needs do we have in Apache Junction to deal with street issues for the homeless that are out on the streets? And finally, what types of homeless support services are available? And again, that's a broad enough question that I think we can get a pretty good discussion on it.
What about literacy and education also? How many of our homeless are either, have some literacy issues or speech issues?
And that would be for, adults as well as for children.
Yeah.
And there are families that have children, and how are they managing the education? But, yes, for adults as well. And, for individuals with addiction and mental health, what services are out there, what services are needed? We can break it down. Again, we'll have, maybe 30 minutes, so, again, the general questions are probably best. So do you have questions that you would like to see?
No. I think I agree with you as far as finding those gaps, seeing what each type of agency is providing to these different populations. I think that's mostly going to be informative for you. And then that will help whether or not in the next round of funding, the commission chooses to have a focus area. So this sort of information will help impact your decisions for future funding.
Mm-hmm.
Or participation in the community, what you want to focus on.
Right. And I'm seeing more and more collaborations taking place, more partnerships being formed. And, it would be interesting to ask them, well, who are you collaborating with?
Mm-hmm.
How are you,
Yeah.
How is this making a difference? Is this something new? Are you now finally reaching out? Have you been doing this for a long time? How does it make a difference when you collaborate with like agencies and with others within the community? I think there's a lot of power in working together. So that would be another possible way to address it.
Well, and it also helps not doing the duplication of whatever each organization is doing. So it makes the money spread a little further because you're not doing this, duplicating the same.
Mm-hmm. Okay. I think we have some questions. Thank you. Okay, do we have any additional information or reports? I think we've seen a lot of information out there, and there are some things that are going on behind the scenes with, and I think I already mentioned that agencies are working to meet the immediate needs that people are presenting with. And our community is coming together very strongly. And I would urge people to continue to do that. So our final item on the agenda is to set our next meeting date. And we are tentatively scheduled. And I think we can do it, whether or not we're physically here. At 6 p.m. on Thursday, April 23rd. And hopefully we will be able to hold it right here rather than on the phone. So
We need a motion.
may we have a motion for adjournment?
We need a motion for the meeting.
Oh, okay.
Yeah,
Yes,
it should be
indeed.
the last page of your package.
Okay.
Can you hear me?
Yes.
We have a motion for it. Do we have a second?
I'll second that.
Okay, vote.
Commissioner Gerstner,
Aye.
Commissioner Bory,
Yes.
Chairperson Daniels,
Yes.
and Chairperson Erickson.
Yes.
So move, Madam Chair.
Thank you. Okay, I move that we adjourn the meeting. Meeting is adjourned.